major problem. Dr. Levy is their medical director, so he's aware of the kinds of problems they're bringing in, these deaths, catastrophic injuries and things. He also is an intensive. So in the ER, he's seeing a lot of people that are coming in with ODs and need immediate detoxification. And detox is, it's nice to take Narcan and reverse it and then start going into withdrawal, but there are a lot of dangers involved in withdrawal also. So he has been involved in developing protocols to get people safely through detox. But then our major problem as a community is what happens after detox. So Dr. Levy is just going to talk to you very briefly about what he's seeing in the ER and what staff in ERs and hospitals are facing with patients that need to be detoxed and need follow-up care in the community.
People that you have here and that last talk was wonderful. I can only say that the world is shot to hell when we can no longer trust SpongeBob. There are a couple of really, I'm a critical care specialist. I really don't deal with the street. I do deal with acute detoxification, especially post-operative patients who will go into shock because we had no idea they were addicted to drugs or alcohol. The other thing is, do not rent motorcycles overseas. This is a bad idea, okay? For a couple of things. One, you don't want to get high or drunk, and you don't want to have something happen in the out islands of the Bahamas. Very bad. We can detox patients very well. We can take, for instance, spinal surgery patients who have suffered chronic pain for years and years and years and who are heavily addicted. Then we find out post-operatively they go into withdrawal. I can literally put them to sleep on general anesthetic and maintain them on mechanical ventilation until they're cleaned up. We can certainly treat almost any kind of acute detoxification in hospital and have them come out. And these withdrawals, by the way, not properly treated, can be fatal. But the problem is, what do you do afterwards? And you folks are the important point here. We can detox a person, a subject, a patient, and if he's not properly treated afterwards, the recidivism rate going back to drugs is going to be greater than 90%. The important message that I have here is not to listen to me because we can take care of you in hospital, but to listen to all the rest of you who are involved in recovery. We need to view drug and alcohol abuse as a clinical problem and approach it not on a moralistic basis, because this is not a failure of religion, okay? This is a medical, social problem. We have ways of approaching it that work, that are proven to work. We know, for instance, that needle exchange will absolutely decrease the HIV rate. We know absolutely that if you supervise properly drug addicts who are shooting, and you have medical professionals who can intervene with Narcan and appropriate cardiopulmonary interventions, that you can save these people from their deaths till they have a chance of recovery. We also know that the DEA certainly has a major job to do here in terms of keeping the pipeline down. But our job as medical professionals is to keep people alive through their withdrawal, and more importantly, give them the opportunity to recover and alive recover to again be members of society and family. That having been said, I'm going to let the people who really know what they're talking about talk, and I thank you all for listening for the few moments of the things I have to say.